Hi, my name is Katherine Williamson from Bio 105 fall semester of 2021. My article that I researched and I will share with you today was called Vaccination Protects Pregnant People and Their Babies from Severe COVID-19. The article info, it included that in the first paragraph, the specialist that was shown was a maternal fetal medicine specialist named Jacqueline Perkim. She had stated that when pregnant, you are more vulnerable to disease, especially the COVID-19. They do not have much research on this due to it only happening a year or two ago. But the longer that it goes on, the more studies there are showing and having proved that the vaccine is more helpful. It also stated that while having COVID vaccine and pregnant, it increases your risk of dying or having pregnancy-related complications. It also stated that after a few large studies were shown, that analysis from those were that the pregnant COVID patients were shown that if they were diagnosed with COVID-19, they were more likely to attend the ICU or intensive care. There was also other large studies on pregnant patients, which some of the data that was included in the article was from the preliminary real-world study on the RNA vaccine. This showed that the vaccine was safe for not only pregnant people, but also for their unborn children too. The data from this study was from 3,900 people who were pregnant and vaccinated. This showed that they did not have an increased rate of miscarriage, birth defect, or pretermed birth. Also, after this study was shown in the article, they also included a part where Perkim, the specialist that I mentioned earlier, was pregnant with her third pregnancy when COVID came about. She went through the complications of people who become pregnant nowadays also are going to face. This is the not knowing whether they should get vaccinated or not while they are pregnant, if they are not yet vaccinated. It talks about the pressures that she faced with the conflict of people wanting vaccinated and people not wanting to be vaccinated and the harms that it could do to your body. She then continued on about how she was a doctor and that even with her knowing these studies, she still discussed with her OBGYN on the safest route to take for her. Some background info is that people are still not sure if the shot is safe or unsafe. So there's research done on how it's unsafe, but there's also research done that it's safe. More of the unsafe research was done closer to the beginning of when the COVID pandemic had arose. And more of the safer research is done towards now recent time. Not only does this article aim more as obviously the vaccine is safer and you should get it whether you're pregnant or not, it also, other research shows that it's less likely to put you in the ICU or on a ventilator if you get vaccinated, pregnant or not. And also new studies are steady coming out on more percentages rising and more studies shown that it is more protective of getting the booster shot or the COVID vaccine. But there's also some unsafe reasons why people don't want to get the COVID vaccine. Some of these may be that the vaccine was only shown to us about a year or less of being come out with to the public. People are unsure about this vaccine because they still don't have a vaccine for cancer or a vaccine for a lot of other things that they feel is necessary before this COVID-19 arose. A lot of reasons why people are unsure about getting the vaccine are majority of them are concerned about the side effects, or they want to know more, or they think they do not need this, or that it may cost too much. People also, with thinking that it's unsafe to get the vaccine, are also faced with the question of how is it going to help if they already had COVID. But these are my works cited, and thank you for listening to my video.